Hello, I'm Dr. Satish Rao from Augusta University Medical Center. I'm the J. Harold Harrison Distinguished Professor in Gastroenterology and Chair and a Professor of Medicine. It is a pleasure to be with you today talking about what's new in treatment options for chronic constipation and irritable bowel syndrome. There is a lot that's happening these days, and it is worth catching up based on some of the recent articles that have been published and also some of the presentations at DDW. Let me first start with chronic constipation. For years, we have used drugs to treat chronic constipation. Fortunately, in the last decade, there has been significant new drugs that have helped us to better manage patients. But a survey done just 2 years ago shows that 50% of patients are still dissatisfied with current treatment options. So can we do better? And here is one suggestion and solution for you. A phase 3 randomized double-blind placebo-controlled trial was just presented at DDW using a novel non-pharmacological capsule treatment called Vibrating capsule or Vibrant. In this study, patients took either the Vibrating capsule or placebo capsule for 8 weeks, and standard primary outcome measures as approved by the FDA were assessed, such as the number of complete spontaneous bowel movements per week over 6 to 8 weeks of the clinical trial. And what they found was 39% of patients who received Vibrating capsule were CSBM1 responders, that is, increase of 1 or more CSBMs per week, compared to about 20 or 22% in the placebo capsule arm. So, significant, robust response. In addition, when they used another criteria of 2 CSBMs per week, about 22% in the Vibrating capsule and 11% in the placebo arm. So, Vibrating capsule appears to be efficacious, but importantly, safety. No diarrhea, no nausea, and this capsule treatment was extremely well tolerated. So you have a nice balance of both improved symptoms and no or very little side effects. So that's something new and exciting for treatment of chronic constipation. Let's look in the IBS arena. There are two compounds that I would like to mention. One, Tenapanor, which is already out in the market, just released in the last couple of months. Tenapanor is a new compound. It is a sodium hydrogen exchange receptor blocker. So what it does is it stops sodium absorption into the intestinal epithelial cell, and thereby more sodium and hydrogen ions all remain in the gut lumen. This in turn leads to laxation and luminal distension. So it is a good treatment, and clinical studies have shown that Tenapanor, the efficacy was about 36% as opposed to a placebo of 23% in large randomized controlled trials. Its dose is 50 milligrams twice a day. It is FDA approved, and I hope you will give it a try in the management of your patients. The main side effect is diarrhea, which led to withdrawal of the drug in about 6% of patients in clinical trials. So that is something you need to watch out for. But I think it's a good option for management of both constipation and pain symptoms in IBS. Another interesting study was just published in the Gut, which was a study that was done in primary care practice of IBS patients. A large study of nearly 450 odd patients. This was a study done in Europe in multiple centers, and they compared the very fancy FODMAP diet, the low FODMAP diet, which is low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet, against a anti-spasmodic therapy. It was, if you like, a real-life trial in the community, not in academia. And what they found was very interesting. 71% of patients who took a low FODMAP diet for 24 weeks were responders. Responders were 50% or more reduction in IBS symptom severity score, as opposed to 60% of patients in the ortolonium bromide arm, the antispasmodic arm. And this difference was significant. So it shows that if patients can adhere, and 80% of patients were happy adhering to this mobile phone guided FODMAP diet, and they got better. So here is another option. We normally prescribe FODMAP diet, but many times we have to rely on a dietitian and so on. But these digital therapeutics are coming. So you can use a mobile phone app to guide how to pick the FODMAP diet when you're in a market or when you're eating in a restaurant, and then use that guide to manage your potential food elements that may be triggering your IBS symptoms. And so that seems to be working very well. So in summary, what I've given you is 3 important treatment options. For constipation, there is a new device capsule which vibrates inside the gut, augments the circadian rhythm, augments peristalsis, and improves bowel function, and appears to be safe and effective. Tenapanor, a sodium hydrogen exchange compound, which really improves IBS pain and bowel symptoms. And then a low FODMAP diet appears to be quite effective and superior to antispasmodic therapy. Thank you for your attention.